recent study of 12 stroke centers in the U.S. suggests hundreds of stroke victims delayed getting care due to fears of the COVID crisis. The Comprehensive Stroke Center at TriHealth's Good Samaritan Hospital was part of that study. And joining me now via Skype is this week's Doctor on Call, Dr. Chris Zammit. Dr. Zammit, you saw this up close and personal. Can you take us through the findings of this study and your concerns about people here locally?
Yeah, absolutely. I mean, really setting the table here, even prior to COVID, it's been an important directive that we have throughout medicine, especially as a comprehensive stroke center, is to help educate the public on signs and symptoms of stroke, to encourage folks to call 911 as soon as possible and get to the hospital so we can treat them as quickly as possible. I mean, you see, with a stroke, it really 15 minutes in delay decreases your chance for being able to go home, walking, being independent, and actually you have a higher risk of dying just with 15 minutes in delay from treatment for stroke. So as you pointed out with this recent study that was led by Dr. Andy Ringer, who's with the Mayfield Clinic, and as you know, we at TriHealth have a relationship with Mayfield Clinic, and we collaborated with them with our data from Good Samaritan Hospital as well as 11 other hospitals, and found that during the 2 months of the COVID crisis, patients were presenting 2 hours later than before COVID. And if 15 minutes is enough to make a difference, I mean, 2 hours is tremendous.
That's amazing. Yeah, we've talked about how people are not coming in to get certain things checked and then they have a stroke they didn't see coming. But this is about you've had one and they're waiting precious minutes, even 2 hours to get there. That's pretty profound. Thank you for putting that out there. I do want to ask you really quickly, Dr. Zammit, before we go. We have 4th of July weekend coming. People are having parties. I got somebody I know putting up a tent in the backyard, inviting people over. Your level of concern, Hamilton County and Cincinnati being highlighted as a hot spot for COVID, and the kids carrying it around.
Yeah, you know, as much as I want to tell people that, you know, it's ready for us to go out there and do what we normally do on 4th of July, I agree with you. I don't think that we're ready to do that, to be honest. We're still diagnosing, 100 to 200 cases per day in Hamilton County alone. When you combine Butler, Warren, and Claremont County, you're still looking at an additional 40 to 80 cases per day that are still being diagnosed daily. We know that some of these folks are without symptoms, some are with symptoms, a lot are without symptoms. So we know that this is definitely a virus that you may be carrying and not knowing it, and unwittingly spreading it to the people that you care about most. So, if you're going to have a gathering, definitely encourage everyone to still maintain a lot of the social distancing, wearing masks, trying to stay 6 feet apart. If you're outdoors, that's even better. Those type of things. I think we need to stay necessarily in isolation of our homes. I think it's okay to socially get together, but I will not be in a crowded place without masks on.
And outside is better than inside.
Yes.
For sure. Okay, very good. Dr. Chris Zammit with TriHealth, we appreciate so much your time. Always could ask you a lot more questions, but we appreciate you weighing in for our Doctor on Call.
Absolutely. Thank you for having me.
Let's turn to our forecast now.